Dr. Frieden, I've had the opportunity to read an advanced copy of your book, The Formula for Better Health. And I have to say it's incredibly insightful. It's clear, unapologetic, and deeply actionable. I think what struck me most is how you managed to connect system level reform with deeply personal day-to-day health decisions. So I want us to spend some time talking about your new release. So the framework, and I know throughout our conversation you've made references to see, believe, and create. Your book introduces a three-part formula: see, believe, and create. Why those three, and why now at this particular time? What makes this the right moment to reframe global health through this lens?
This was something that I began working on 10 years ago during a time when the Ebola outbreak in West Africa was out of control. And it was clear to me that a lot of people didn't really understand what public health is, why it's important, why they should support it, or within public health, really how to succeed. And I want to say at the outset that proceeds from the book will go to groups and projects working for health around the world. Nothing comes to me. And the See, Believe, Create framework is a proven approach to close that deadly gap between what we know will save lives and what we actually do, both as a society and as individuals. The C is to see the invisible, to make invisible threats visible, whether they're microbes or toxins or trends, whether programs are failing or succeeding, why, to see why we ignore some of the warnings, and to rigorously see the pathway to progress. The believe is about believing, building confidence that progress is possible, even in these difficult times, because it is. We have great tools, we can do great things. And then the hardest part, as if seeing the invisible and believing the invisible weren't hard enough, the hardest part is to work together to create a healthier future. And I break that down into organizing, prioritizing, simplifying, communicating. And then once you have a simple, organized, well-communicated approach, overcoming the inevitable barriers that we face in public health. It's a book about hope, but it's also a book about how to get it done. Not just blind optimism, things are going to be fine, but what do we need to do to systematically make progress? And I have to say that I learned a lot in writing this book. I learned, for example, why? Why do we ignore so many warnings? Or what was Alice Hamilton doing, and how did she have such success, and what was the failure of the society to listen to her? So there are a lot of things in here that are from other people's experience, some from my own, but it's really about the approach that can save millions more lives.
And I think you also describe a little disconnect between what we know and what we can do, or what we do, as you term it, the deadly gap. Why does this gap persist even in countries with world-class data and resources? And what would it take to close that gap systematically? If you can briefly, talk to that concept.
I think the working title for the book was How to Break Public Health's Cassandra Curse. But then I found out that most people don't know who Cassandra was. And so that wouldn't have been a very good title. But Cassandra was a mythological priestess from ancient Greece who was blessed with foresight. She could see the future, but she was cursed. Nobody would believe her, so they didn't change their behavior. And the tragedies that she foresaw came to pass anyway. Terrible. Can you imagine that? You're seeing people are going to die, the people around you are going to die. You tell them, do this and you won't die, and they don't listen to you, and you watch them die. Terrible thing. She went crazy, actually. Public health has been like Cassandra. We can see the future, but we can't convince people to change it. So this is an approach to breaking the Cassandra curse. But what I realized as I did research and thought about it was, why? Why do we ignore warnings as society and as individuals? And fundamentally, it's that our perceptions of the world are inaccurate or incomplete. our perceptions of ourselves. We may think we have more purview over our decisions than we do. We may think we have complete free will, but we don't really. Whether it's advertising or tobacco products or social norms, a lot of our own behaviors are things that we do because people around us do. We also have inaccurate perceptions of the world. We may not realize that little things lead to large improvements or harms. This is what's called the prevention paradox in health, that the invisible things make the biggest difference often. It's also true we have inaccurate perceptions about the future, something called hyperbolic discounting, where we really don't take account of future events or even past events as vividly as we should. So the trick is to break that Cassandra curse by understanding what's driving it and then coming up with ways to counter each of those drivers of that part of human nature that leads us not to attend to deadly warnings. And I go through that in the book in detail, applying it not just to society, but to us as individuals. There's a personal health message here as well.
Yeah, and I think the book also highlights the strength of prevention. One of the lines that really hits me is that a single life saved by heroic surgery is seen as a miracle. A million lives saved by prevention are invisible. How do we shift that mindset, both for policymakers and the public?
Well, it's been said that culture eats strategy for breakfast. And we may not be able to shift that mindset. Occasionally, you get a public health leader in or a leader in who understands public health. And I have to say, Mike Bloomberg does. And so he was clear when I was health commissioner. He asked me one question: is this going to save lives? I said yes. He said, then we'll do it. You don't get that very often from political leaders. So you also need stories. People aren't generally convinced by data, but they may be convinced by stories. Not inaccurate or irresponsible stories, but real stories. Take the example of parents whose children died from influenza and didn't get them vaccinated against influenza. They're the best messengers to tell parents, please get your kids vaccinated against the flu. So I think we need to make visible the invisible. We need to show progress. We may need to show progress in things that people really care about so that they'll have more confidence that we can deliver a healthier future.
I want you to give us one core takeaway from this book and also your experience in general. If our listeners walked away from this episode with just one lesson from your book, what would you want that to be?
There is an approach, a formula that has been proven to have saved millions of lives, and it can save millions more, including your own. It involves seeing what's really happening, seeing past the obvious to the real threats and status of our efforts to protect people's health. Believing that we can make progress, because we made a lot of progress in the past, and we can strengthen that belief by making stepwise progress forward and creating a healthier future by prioritizing, organizing, simplifying, communicating, and overcoming the barriers by empowering people who will benefit from public health progress. A life where deaths at a young age are, let me say this differently. It is possible to have a world where death at a young age is very rare, where people live healthy into old age and without decrepitude, without dementia. That life is possible if we follow the formula for better health.
And finally, as I said earlier, most of my listeners are global health or public health professionals and students. And I know most of them will not have the opportunity to meet you in person. So if you had, say, 60 seconds to speak directly to the next generation of global or public health leaders, what would be your wake-up call to them?
Public health is a great place to work. Archimedes supposedly said that give me a lever long enough and the right place to stand, and I can move the world. How many people can come to work in the morning and say, if I succeed, people who would have died or been injured or disabled won't be? That's a wonderful place to work. Use this focus to understand the data, to see the real trends, to build confidence and progress, to create a healthier future, because there's no profession that is as satisfying as public health. You do work that's so meaningful, saving millions of lives. You learn all the time because we're all learning all the time, and that's really refreshing, satisfying for adults to be learning. And it's great to work with so many other committed people, learning with each other, learning from each other, and working together to walk into that healthier future where death at a young age is rare.
Book, The Formula for Better Health, How to Save Millions of Lives, including your own, is now available. I've read it myself, and I can say it's for anyone who wants to live longer, lead better, and help others do the same. You can pick up The Formula for Better Health by visiting Amazon and most of the bookshops near you, including MIT Press. And you can follow Dr. Frieden on Twitter and on LinkedIn. I do myself, to keep up with his latest work and what he continues to do for global health. Thank you for tuning in your Global Health Uncensored. I'm Dr. Banda Khalifa. Until next time, stay committed to building a healthier future. Bye-bye.